I'm Dr. Daphne Bascom, and I am delighted that you are joining me today for another episode of the Thrive on Plants podcast. October is Breast Cancer Awareness Month, and today's conversation is especially meaningful. I'm joined by Alison Tierney. Alison is a board certified oncology dietitian and a breast cancer thriver who brings both professional expertise and deeply personal experience to her work supporting cancer survivors. At just 33 years old, only 10 days after finishing breastfeeding her second daughter, Allison discovered a lump that would change everything. Despite being what everyone called the healthiest person they knew, she was active, plant based, doing everything quote unquote right. She was diagnosed with invasive ductal carcinoma. Today, we're going to dive into the missing piece in survivorship care, why so many women feel abandoned after treatment ends, and how plant predominant nutrition and lifestyle medicine can empower them in this next chapter. We'll talk about navigating the fear, the conflicting nutritional advice, and the isolation that so many survivors experience. And most importantly, what Allison wishes more survivors knew about building confidence and clarity in their choices. Whether you're navigating your own cancer journey or supporting someone who is, or you simply want to understand how nutrition and lifestyle medicine can make a real difference, this conversation offers hope, some practical wisdom, and some inspiration, because Allison is definitely an inspiration to me. I hope you enjoy this conversation as much as I enjoyed speaking with Alison Tierney. Let's dive in. So, Allison, thank you so much for taking the time to join me on the Thrive on Plants podcast. I really can't thank you enough for making time in your busy day.
Oh, thank you so much for having me. It's a pleasure to be here.
Allison, I have admired you from afar for many years. I first became aware of you through PCRM and I stalked you for a while. And then we had the pleasure of presenting at Peapod and had an opportunity to get to know each other a little better. But I don't know that the Thrive on Plants community knows you. Would you mind sharing a little bit about your journey, both to becoming plant based and then also your journey as a breast cancer thriver?
Yeah, absolutely. So I'll try to make the whole journey and story as brief as possible because it's kind of long, but I'll make it as
That's
simple as
okay.
possible. So I am so honored to be here. Like I said, my name is Alison Tierney, and I'm a board certified oncology dietitian and a breast cancer thriver, as you have alluded to. And so, really, my story begins a long time ago in that I actually went to school to for business, and that's what I was going to be doing. However, when I was in college, my mother was diagnosed with breast cancer. My grandfather was diagnosed with liver cancer. My grandmother, before I was born, passed away from lung cancer. My godmother was diagnosed with breast cancer, and my other grandmother is a breast and uterine survivor. And so there was just generations of cancer that afflicted my family. And I started to wonder how nutrition could play a role. And nutrition really started for me, which I'm sure your audience can appreciate, is as an athlete. I wanted to know how could nutrition improve my performance. And how I did that really focused was on looking at how I can improve my performance and recovery with nutrition. I wanted to know how nutrition could play a role to help reduce the risk of cancer. How could it help my family members during the course of treatment? And how could it help them in survivorship? And where my interest in nutrition really started was in sports nutrition as an athlete all the way through college. But all these cancer diagnoses really impacted my thought process and how I think about nutrition. And so that's really what led me to the oncology nutrition space. And so after I actually graduated from college with a business degree, I went back to school to become a dietitian, did a second bachelor's degree, and then also finished my master's degree. So I went to school for a really long time, and I joked by the end of my second bachelor's degree, I joked with my husband that most people that go to college for 8 years have their doctorate, like yourself, Daphne. And so, but I didn't. I had 2 bachelor's degrees, and then I went on for my master's. But I wouldn't change it. I had such lovely experiences that could not be replicated if I didn't do that. So Anyways, after when I went to dietetic school, I told all my professors, I want to be an oncology dietitian. That's what I want to be.
Mhm.
And so I got every opportunity I possibly could get my hands on to learn about oncology nutrition. And really, because in dietetic school, you have one hour lecture on oncology nutrition.
1
That's
hour.
it.
Okay.
1 hour, right? And so I wanted every opportunity. And thankfully, there were many oncology dietitians that took me in to let me shadow them, to let me learn from them, ask questions. And then I ended up getting an opportunity to have my internship in oncology nutrition. Landed my job outside of college, which is exactly what I wanted, was as an outpatient oncology dietitian. And the rest is history when it comes to my education component. However, my education became very deeply personal after a little while. I was working at a cancer center where I started, grew, and run the oncology nutrition program because there wasn't oncology nutrition established at this cancer center. While I was working there, I like to say that I actually stumbled upon plant-based nutrition during that process. I did not grow up plant-based. I
Mhm.
would consider how I grew up eating as a healthy standard American diet where we really didn't have a lot of red meat. We didn't eat much fast food. My mom made almost all of our meals homemade, all the things. But it wasn't plant-based. I didn't like beans. I was not a big vegetable fan, all the things. And so when I came across the plant-based diet and all of its benefits against cancer, and really this desire to help my patients as best as possible, I thought, wow, I really need to try this myself.
Mhm.
And so that's where I slowly started adopting more of a plant-based diet. It didn't happen overnight for me. It took, just some time. First, it was like, I think I'm going to stop drinking milk with dinner. And I'm from Wisconsin, so I like to joke the land of beer, cheese, and sausage, right? So milk at dinner is like a very normal thing in Wisconsin, especially how I grew up. And so that's how it started. And then another month later, I was like, I think I'm going to try being vegetarian for this month and see what happens. And I haven't eaten meat since. So it was like this slow and steady progression. Now, I wasn't completely plant based for a little while. And really, what triggered me to adopt it 100% was unfortunately, my husband and I were struggling with infertility. I
Mhm.
have PCOS or polycystic ovarian syndrome, which is the number one cause of infertility in the US among women. And I was trying to figure out, okay, what can I do to control the controllables, right? What can I do to help myself in this whole process? And that's where I started looking a little bit deeper into the plant-based diet and researched a little bit further. Is this helpful and healthy with PCOS? Is it healthy for pregnancy? All the things. And the answer, of course, was yes, plant-based nutrition could be helpful for my PCOS. And if I do get pregnant, it's incredibly healthy during that time too. So thankfully, I turned to my husband and I said, before we move on to more fertility treatment, I would really like to try the plant based diet 100%. I just want to go all in and
Mhm.
see where it takes us. I said, you don't need to do it with me, but I would like your support in the process. And my husband, thankfully, he's not picky. He's super supportive. He's like, yep, if you think this will help, let's do it. And long story short, I got pregnant like 3 weeks later for the first time. And I hadn't ovulated in over a year and a half because I was taking, ovulation
Okay.
test strips because we had been trying to get pregnant for quite some time. I knew that I didn't ovulate, so I was
Mhm.
constantly checking. And only 3 weeks after fully adopting the plant-based diet, and I say that with the caveat that I was slowly incorporating more plants and less animals, but once 3 weeks after I fully did it, I ovulated for the first time and got pregnant and had a beautiful baby girl 9 months later. And now, oh my gosh, she's almost 9. She's thriving. She's doing really well. And also, spoiler alert, I have a second daughter. And so, needless to say, I did not turn back on the plant based diet after becoming pregnant with my first child. And honestly, for PCOS and everything, things really did improve. My skin cleared up. I had horrific hormonal acne. My obviously my cycles got more regular. All types of things, and I just felt better overall. And so there was no looking back from that standpoint. And it was that time where I was really incorporating it into my practice as an oncology dietitian and really incorporating more whole unprocessed plant foods for my patients. And I started to see the benefits for that too. And so, fast forward a little bit, I continued to work at the cancer center, and then I got pregnant with my second child, nursed her all the way through. And unfortunately, then that's where the story takes an ironic twist, is what I usually like to say. And only 10 days after finishing breastfeeding with my second child, I had my annual OBGYN exam and we found a lump in my breast. And at first, we really didn't do anything about it because I just finished breastfeeding. Like, there's so many changes in the breast. It could have been a clogged duct, whatever it might have been. And so we didn't do anything, and we didn't schedule a follow-up, we did nothing. And so I came home and I kept feeling the lump. I told my husband, I'm like, "We found this lump. Can you feel it? So that way we can keep an eye on it. If it changes, if it grows, does it go away? Does it get smaller?" Well, it didn't. And so I was actually preparing to be a PPOD, or plant-based prevention of disease conference presenter, in May of 22 on breast cancer nutrition. And while I was preparing for that presentation, I was, redoing some research and looking more, and came across an article about cancer after breast cancer, or excuse me, breast cancer after nursing and pregnancy. And although rare, how possible it is, of course. And it was that little trigger where I was like, you know what? I really need some peace of mind right now about what this lump is before I go stand on stage and present about breast cancer nutrition. So reached back out to my OBGYN, and she actually was my mom's physician before. So she knew my family history. She unfortunately had to diagnose my mom with breast cancer. So she was really quick to say, like, yes, let's get that checked out. And I feel really grateful for that, because there's a lot of women that that's not their experience, right? I was 33 years old. Most women and their sometimes I hear the stories of, well, my physician said you're too young, it's not cancer, it's nothing. And it just turns into this really long, lengthy process to actually get diagnosed. I feel very grateful that that was not my situation, because my doc was like, nope, let's get it checked. So ended up getting an ultrasound, which immediately led to a mammogram, which later led to biopsy, all within a few hours of each other on the same day, and then a diagnosis of breast cancer. And with that being said, first, initially, I was diagnosed with DCIS with microinvasion, which would have meant that it would have been stage 0 breast cancer, and that it was contained to the mammary gland. And really, what ended up happening, I had actually multiple biopsies, because my breast surgeon kept saying, like, you're not presenting with DCIS. Like, you have a lump, you're presenting as invasive. So we need to, like, make sure this is actually true, right? So I had another biopsy, and it still came back with the same diagnosis. So in that time, I had genetic testing, and because I was 33, just automatically, like, when you're that young with a cancer diagnosis, your genetic testing is included with your insurance coverage. And I was a little bit surprised, but not completely surprised, to find out that I do carry a genetic mutation for breast cancer and other cancer types. And the reason why I say I was surprised was because only a very small percentage of cancers are actually related to genetics. And I knew those statistics, but at the same time, I had this extensive family history. So, anyways, because of the because of where the tumor was located in the breast, they were recommending at least a single mastectomy. But once my genetics came back positive, they were recommending a double mastectomy. So I did choose to have a double mastectomy with something called deep flap reconstruction. So deep flap reconstruction is when you recreate the breast with the individual's own tissues. So I do have reconstruction, and it's made completely out of my own tissue, and I don't have any implants. And that's a really intense surgery. It's about 10 hours long, depending on who you are and how it goes. And it's a very long recovery. So I had a 14-month-old baby at the time and a 4-year-old. And that, I would say, was probably one of the most difficult things, not being able to hold my baby. Who knew that I would, like, miss diaper changes, right? Until it's taken away from you, right? And after that, I was not supposed to need any other treatment, but unfortunately, the pathology from the surgery actually came back that it wasn't DCIS with microinvasion, that it was, in fact, invasive ductal carcinoma, which means that it can potentially leave the mammary glands. And so, therefore, then you go on for further testing. My testing came back triple positive, which means that it was positive for estrogen, progesterone, and HER2, which is a type of protein. And so what that included was 3 months of chemotherapy and targeted therapy, followed by another 9 months of targeted therapy for 1 year of infusion. And so after I finished that, I had another breast revision surgery. And then a year after that, I had another breast revision surgery and a hysterectomy. But I am now thankful to say that I'm exactly 1 year out of that hysterectomy and hopefully crossing fingers that that should be my last surgery. My now almost 9-year-old daughter says, Mom's last surgery ever. And I'm like, yeah, we're going to go with that. We're just
I
going to
love that.
assume that's it. Right. And now I can say like I'm considered cancer free and in remission. And I have a lot to be thankful for. And really, honestly, nutrition and lifestyle, I believe strongly played a huge role in my ability to get through treatment and to be on this side of treatment the way that I am.
Allison, that is quite a journey. And I don't even know what to say. And you are a role model for so many of us because you've been through this with a smile and with a very practical approach. Uh, but if you don't mind my asking, I actually just got off a call with a client who is battling a health challenge. And she's like, I'm doing everything right. Why did this happen to me?
Mhm. Absolutely.
How do you reconcile, and I'm sure you hear that when you speak with some of your clients or when you were at the cancer center,
Mhm.
people who feel like, "I've done all the right things, but"
Absolutely. And she is so valid in those feelings. And I don't know your client, but I'm imagining she probably was doing all the right things,
Yep.
right? When
Mhm.
it comes to checking the box of what you can do to reduce your risk of developing cancer in the first place or some other chronic illnesses, I could check every single box. I didn't drink alcohol. I've been physically active my whole life. I've always been lean and a healthy weight. I breastfed
Mhm.
both of my kids. I had my first child before 30, right? Like the list just goes on, right? And so a lot of people would turn to me and say, Allison, you are literally the healthiest person that we know. How could you have breast cancer? And I'm not going to lie, absolutely. I have had those feelings of why did this happen? What did I do wrong? And I think a lot of cancer patients, I don't want to speak for every single one,
Mhm.
but I do see the commonality that we think about. We go through this Rolodex in our mind of like, what did I do wrong? Where did I
Mhm.
go? Where did I miss it? And that is a big, like, big, huge pill to swallow, right? Like, and it was truly the realization because, of course, just like most people, I had anger about it. I had sadness about it. And the whole why me, right? Why did this happen? And it wasn't until I really realized and focused on that all the things that I was doing to control the controllables and doing all the quote unquote right things. I always say it like in quotes because I wasn't doing it perfectly, right? I had a 14-month-old baby at home. Like I wasn't sleeping great nights or
It's not
exercising the
perfect.
way that I wanted to. Like, and but you know what? No matter what season of life, like I don't know anybody that's doing it perfectly, right? So, anyways, it wasn't until I realized that all those things that I was doing right were the things that were going to help me through this whole process. And that reframing, I think, was really powerful for myself as I was going through and approaching treatment of like, okay, I did do the right things.
Mhm.
It's just like this still happened. Cancer does not discriminate based on age, sex, race, what any of it. And I've also thought to myself, and no one could ever prove this or I could never know, but what if I wasn't doing those things? Would I have
Mhm.
caught it as early of a stage as we did?
Yeah.
We'll never know, right?
Yeah.
And also, one of the most encouraging things that I heard was one of the oncologists, the genetic oncologist, who we do more of the genetic stuff with. He said, you have no idea how many lives your cancer diagnosis just saved. And it was because of the genetic mutation. Unfortunately, all of my siblings found out carry the genetic mutation,
Mhm.
which means they have earlier screening, right? Hopefully, earlier detection. And he also went on to say that if you have a known genetic mutation, although you are more likely to get cancer, you're actually less likely to die from cancer than the average person because of the earlier screenings, catching it early with more information. So it was more about, okay, not that I would ever want it, but right,
Right.
okay. I'm taking on this diagnosis. I've been able to find this genetic, let's just say, curse in the family that identifies this mutation. And now my siblings and their kids and my kids will all have more information as their time goes on of to get earlier testing and all that. So yeah, it's so hard to be like, gosh, I did everything right and this still happened. And it sucks. And I always tell my patients, right, you have every right to be angry about it. But then the next step, I think, is what are you going to do about it? Right. I can't change my genes. Never will be able to. Can't change the genes that my kids get. And I look out the window as I'm talking because they're running up and down the street and they're playing. Right. And I just feel so blessed to be able to have them and watch what they're doing and being active and healthy and all those things. I'm terrified that they have my genes, right? That they have that. But can't control that, right? I can teach them about healthy lifestyle. I can teach them about food and try to establish the best foundation that I can for them and hope that that we're doing the right thing, right? And so I think that is really where the focus should be is really focusing on what can I do. So really in my own practice I focus on control the controllables. What
Mhm.
are the things that you can control and I say, try to let the rest go, right? Because it's really easy for me to say, just let the rest go. It doesn't even matter. I'd be lying if I said I never thought about my genetic mutation or the risk that it puts me at. Like, it's trying to let the rest go.
And controlling the controllables is all any none of us can do anything more than that. Because once you and it's a blessing in a way that you are able to give this gift to the rest of your family. But now that you are healthy again and you're thriving, what information did your care team tell you about how do I reduce my risk of cancer recurring? Or what do I need to do differently in order to reduce the risk of any, whether it's a second breast cancer, a secondary cancer of any sort, coming and impacting your life for the next 90 years?
Yeah, I wish I could tell you that the answer was they just gave me all this information and reassured all the things that I was doing. And No nothing, right? I do think that's something that's unique about my position, although I do think that a lot of cancer survivors have the same experience and that they don't get more information about diet and lifestyle and how that
Mhm,
can impact their risk. The unique part of mine is that my whole entire team were once my colleagues when
mhm.
I was treated at the same cancer center that I worked at previously. So I was very blessed to be able to essentially handpick my team. It's just like this weird sort of morbid thing that I knew if I ever got cancer, this would be my oncologist, this would be
Mhm,
my surgeon, right? Like I
mhm,
just knew exactly who was going to be my team. And so with that being said, they all know who very well who I am, what I how I practice, how I live my life that they didn't touch that subject with me very much and I think I don't know if it was a combination of because I even asked my husband and I was like, "Okay, when they come into the exam room and talk to me, is that what they're asking other patients? Or is it just that they're not asking me
mhm,
about it
mhm.
because they know like what I do?" I probably think it was maybe a combination of both. And my oncologist is so great in knowing that I did fast for chemotherapy, and we can talk about that later if we want
Okay.
to, but I brought in all the research that I wanted to show him when we were talking about what my chemotherapy protocol would be, and I told him, "Okay, I want you to look at this is what I'm thinking about doing," and he just looked at me, he goes, "Allison, I know you know what you're doing. I trust you. Just you go ahead." And, like, so I did have that kind of relationship where I would maybe say like, "Hey, could you draw my fasting insulin this next time?" And never really ask questions, right? And I don't think that's the same relationship that a lot of people have with their oncologist. So I
Mhm.
have a little bit of a unique approach from that standpoint. But usually, when I'm talking to my own clients, I say, okay, we should request these labs to draw, and here's why in case they ask, right? And so that we do have reasons for it, and we have evidence based reasons as why we want to do something or change something, et cetera. So I wish I could say there was a whole lot of information given, but there wasn't from my thing. But that's also the experience of most of my patients.
Mm, 100% agree, and that's the case with breast cancer, almost any other type of cancer at this point in time, although I know with people hearing your message and some of the initiatives that the American College of Lifestyle Medicine are putting out, that the knowledge is growing. But you touched on a couple of things that I love to pull the thread on, and one of them is fasting. Uh,
Mm.
I know a lot of women think about fasting in terms of weight loss, but it sounds like that you were really focused on your metabolic health while you were going through treatment, and then also whether a fast around the time of your chemo could help sensitize you to a better outcome. Do you mind sharing a little bit about
Sure.
why you took that approach and what the data recommend?
Yeah, so absolutely. I would say that the fasting approach was actually not related necessarily to my metabolic health during treatment.
Mhm,
I have different approaches post treatment now that are related to my metabolic health, especially as someone with PCOS that I'm very focused on. But I do want to go back to chemotherapy and fasting. I will say that in the US, it's definitely not standard practice. There's lots of questions about it still. There's a lot of concerns. However, there is a decent amount of data around it, and the data is incredibly promising.
mhm,
And I think what's difficult about the data, it's not all cancer types have been studied, not all cancer treatment regimens have been studied, et cetera. Like there's still more work to be done. And I also have to say the caveat that it's not for everybody, right? If somebody is already malnourished going into treatment, if they are already underweight going into treatment, these are not necessarily things. So someone should absolutely be looking to their health professional to help decide if fasting for treatment is even a suggested thing, and if so, what routine, what cycle of fasting are we going to do? Because it very much depends on their treatment regimen and so forth.
mhm,
So, after saying those things, I truly was very interested in fasting immediately with chemotherapy. I had worked with several of my own patients about it, and truly the understanding and the idea of what fasting prior to, during chemotherapy, and for like the 24 hours after chemotherapy. So it's like that window of it is truly around the idea. The strongest evidence there is reducing side effects related to chemotherapy. And I like to try to simplify it very much in saying that we have all these great healthy cells that when our healthy cells are actually essentially in starvation, they go into protection. Okay.
mhm,
Hey, we don't know when our next meal is coming. So we are going to protect all our most important cells and just hold on to that, put a shield around them essentially. Cancer cells, they have one job: keep dividing, keep growing, keep going, 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 going. They don't have this protection mode like our healthy cells do. So the concept is that if we're protecting our healthy cells, which are typically very much impacted during chemotherapy, because chemotherapy and other treatments are going to impact rapidly dividing cells,
mhm,
our hair cells rapidly dividing, our GI tract rapidly dividing. That's why we see hair loss, nausea, vomiting, bowel changes as very common side effects because those are rapidly dividing healthy cells. But if we can put those healthy cells into protection mode, we might see fewer side effects. From my own personal experience and from also the experience of my patients that I've worked with fasting, I do see this come into reality and that they have much less side effects related to treatment. Now, research also shows that even though the most common concern is always going to be weight loss, research actually shows that significant weight loss does not occur with fasting for chemotherapy as long as it is done correctly.
mhm,
And because it can absolutely be done incorrectly and can be harmful if not done the right way. For me personally, I had chemotherapy every single week for 12 weeks. And so that could be a lot of fasting. And I will say, probably by I think it was like my third or fourth cycle, I had lost just a little bit too much weight that I thought that I should have in those 4 weeks. It wasn't significant, but I was like, ooh, if this trend continues,
yeah,
it's might not be a good thing. So I ended up altering my fasting a little bit, and then I was able to maintain weight the rest of the way through. And I had very mild nausea. I didn't even have to take any of the anti-nausea medications. I was able to live a higher quality of life. I never didn't fast for
uh,
chemotherapy, so I don't know what the opposite would be. Some of my patients, unfortunately, have not been able to fast for a cycle because of different reasons. So they've had the experience of like not fasting and fasting, and they very much notice the difference.
Okay.
But again, it's very important to make sure that we are monitoring our weight, our lean body mass, making sure that those are staying stable, because lean body mass is the most important thing during treatment and that we're maintaining it as much as possible. Because if lean mass goes down, toxicity from chemotherapy goes up. And so that's the biggest thing. There are some thoughts and ideas that if we're fasting for chemotherapy, it may improve the efficacy of how chemotherapy works against the cancer cells, potentially having better outcomes. But I would say that the data is more significantly there for side effect management and potentially greater outcomes otherwise.
And how do you so the maintenance of lean body mass is another important conversation because and I'm dating myself. I remember being in the oncology center and there used to be probably the least healthy food there because the goal was let everyone eat whatever they want to eat because they're going through therapy and they deserve to eat. What is how do you navigate the psychology of healthy eating as a cancer thriver, both before you start your therapy, and I'm thinking about pre-surgery, making sure that you are in your healthiest state possible, because if you're going to undergo a 10-hour surgery and recover, you wanna start from a healthy position. While you're going through therapy, there's definitely going to be food challenges to navigate, both environmental and psychological. And then post therapy, how do we coach men and women to overcome food fears, food phobia, um, post therapy? I know those are three
I was
part
going to say,
questions. It
wow,
was a
that
big
is.
one.
Oh, goodness. Yeah, but I mean, such excellent thoughts and approaches to those questions because they are very important and unique in each of those stages. And so, leading up to surgery, you're right. We want to try to get them in the healthiest state as much as possible leading into surgery. And honestly, I think that was one of my benefits is that I was very active. I was leading a really healthy lifestyle. So, going into surgery, I was young, I was strong, I was healthy outside of having cancer, right? A lot of cancer patients, they'll be like, but you're healthy. And then you're like, but am I really healthy if I just got diagnosed with cancer? Right. So we joke about that a little bit. But I really did focus on trying to keep my physical fitness up as much as
Mhm.
possible leading into surgery because I knew I was gonna be pretty sedentary for several weeks, like, so I have so of course the mastectomy scars, but with the deep flap, I have a scar from one hip to the other, right? There's major abdominal surgery happening there. I knew that I wasn't gonna be able to walk the way that I normally do or exercise. So if I can get my physical fitness to the highest level possible, then hopefully it won't tank nearly as far when I
Mhm.
have that time. But not everybody has, like, the benefit of preparation for those types of surgeries, right? I had to wait 8 weeks from diagnosis to surgery, and
Oh, wow.
that was a mental game. That was very scary knowing that you're living with cancer, like, what's happening? Where is it spreading? What is it, right? But I was able to put time into being like, "Okay, you're gonna be as physically active as you can. You're gonna maintain your muscle mass by doing resistance training, and you're
Mhm.
gonna eat the best possible way you know how." So I definitely emphasize, plant-based proteins, but also other nutrients like zinc, omega-3 fatty acids, and other nutrients that are going to help prepare for surgery and recovery from surgery.
Mhm.
So there are those components to it. Now, when it comes to treatment, gosh, that's a whole another beast in itself from the standpoint of how we each respond to treatment is going to be very different. For example, one of my therapies that I was on commonly causes diarrhea.
Uh-huh.
Did not happen for me. Complete
Interesting.
opposite, right? And so, like, sometimes the most common side effect might be this, but it may never happen or the opposite will happen, right? So, how we all respond is very different. So, as an oncology dietitian, I work with patients for those very specific needs as they come up. There are
Mhm.
some treatments, for example, that they have super common, like a high percentage of patients will experience that side effect. So, for example, there's a chemotherapy called irinotecan. the most common side effect is diarrhea, right? So
Mhm.
before we start treatment, I'm going to counsel my patient on what are dietary recommendations for diarrhea so that they are prepared when they come home from chemotherapy, should that happen, right?
Okay.
And I will say, I think this would be a really great research study, but I haven't seen many studies on this yet. But anecdotally, the patients that actually have more whole, unprocessed plant foods in their diet during the course of treatment tend to have the least amount of side effects and overall better quality of life. Um, and that is not just coming from me, that's other dietitians that I've consulted with and everything that I'm like, "Hey, these patients are having, like, really good outcomes. They're not having the side effects as deep or as aggressive as other people would." And there's so many different factors at play, but nutrition and lifestyle is one of them. Now, when it comes to survivorship and to kinda touch a little bit on the fear factor, it's so valid. I would be lying to you if I didn't think about certain things where I was like, "Oh my goodness, is this going to increase my risk? Am I not having enough of this or am I not doing this?" Um, I've only had small little doses of issues with that. And I feel grateful again for my knowledge just based on what my career was and is that I was able to essentially talk myself off the ledge of like, okay, but you're doing this, you're doing that, you're controlling the controllables. The rest you have to let go of because there is this dividing place between how much stress is caused by thinking about and worrying about what you're eating versus just simply eating. And that's a very difficult juggling act when it comes to how to navigate that for someone. And that's where I really think it's important to have a oncology dietitian on your team to be able to sit down and talk about those things. And for me, it's actually about learning who my patients are, what
Mhm.
motivates them, what scares them, what is their support system at home. All of those things play a role in how we're able to address these issues. It's not just this black and white blanket approach for everybody. And I think sometimes it seems like it is, and it's like, "Wait, no, there is so much more to it." Food is not just physical, it's
Yeah.
mental, it's emotional, it's spiritual or religious for a lot of there's so many dynamics that go into it, um, that it's really complicated, to be honest. But I will say that, um, at this point in my survivorship, I'm almost gosh, it's crazy. I'm almost, um, 3 years out of chemotherapy, and
Okay.
I will say that I probably have some of the healthiest approaches to food right now in this part of my cancer journey than I have before, and it's a very strong balancing act of enjoying food and allowing food to nourish me, right? And I want to teach my girls that food is delicious, right? I think God made food taste good for a reason so that we'd eat it, right? But also having that balanced approach of what do we get to enjoy, but we also need nourishment. We also need fuel. And I love helping my patients find that unique meeting point for where nutrition brings joy and nourishment and where it meets in the middle for them. Because I think where it meets for me is going to be different for you and it's going to be different for somebody else.
Mhm.
And I want to help my patients find that place. So that way we are getting the nourishment, but we're also getting joy and reducing food fear as much as possible.
And that is a difficult intersecting circle to try and manage because even and I don't know if this was something that you experienced, but even outside of a cancer journey, people sometimes turn to food for comfort. And the comfort foods aren't always the healthiest foods.
Mhm.
So I see a lot of women who start with a less than healthy relationship with food, and I can imagine navigating that as you're going through cancer treatment can become a little fraught with, uh, other additional challenges as you layer on, how do I keep my body healthy and not allow some of my emotional attachment to food to outweigh my need to fuel my body healthfully?
Absolutely. And I think what's often missing, not just from oncology nutrition, but nutrition as a whole, is those other pieces of what's happening in that individual's life that impacts their food choices, right?
Mhm.
Because I say in the context of oncology, okay, you're having treatment, which is causing you fatigue, which means that you have less desire to cook, which means you choose less healthier choices, which makes you actually more fatigued, which just keeps the cycle very vicious and continuing. Let's take oncology out of the concept there. And it's okay, a woman that has 3 kids, works a full-time job, is trying to navigate her health, and is just exhausted by the end of the day. Telling that particular patient to eat one thing or another is going to be impacted by what her life is driven by in that season of life. And I think that is so often missing from the conversation, especially when we see certain things on social media or whatever it might be, to be like, well, we have to eat this, this, and this, and there's no context around it. And I think that is super important to discuss with patients. So, like, there are some times where I'm working with a client and we'll finish a session for the day, and they'll be like, wait, did we even talk about food today? And I'm like, "Actually, it doesn't seem like it, but
Right.
we did because we're working on changing the different modalities of things that are going on in their life." And that's exactly what lifestyle medicine is, if you ask me, right? Is how do we juggle all these different pillars that make a difference in someone's life, right? If you're sleeping horribly, you're not going to probably make good, healthy nutrition choices, right? So I might be working on someone's sleep hygiene in order to help improve that. Or they have really bad strategies for managing their stress and have no
Mhm.
boundaries whatsoever in their life, right? How do we work on that for the patient? So a lot of times, I bring people in with nutrition, but we just focus on so much of their whole person health that really truly turns to lifestyle lasting and sustainable change.
100% agree.
Mhm.
Now, do you have any compelling data that you could share regarding survivorship in plant-based nutrition? Because I love how you phrase it. You're not asking people to become plant-based, but you're meeting them where they are and asking them to become plant positive. But
Mhm.
are there data that you're aware of that may help encourage people to become more plant positive if they're navigating any type of cancer journey?
Yeah, absolutely. There is a very strong data to show that the higher amounts of fiber that we can consume actually reduce the risk of cancer development in the first place and in survivorship, reducing not just cancer risk, but also overall all cause mortality, which I think is very important. Also, from the standpoint of, we know that plant foods have phytonutrients or phytochemicals in them. Probably one of my favorite things to talk about, also fiber. But really, because these are these nutrients that, I mean, I didn't learn about growing up. They weren't part of, the food pyramid while I was growing up in school. And I know it's different across the stages for a lot of people, but these are these nutrients that they're not macronutrients and they're not micronutrients, but they are nutrients that I would say you can live without them,
Mhm,
but I don't think you can thrive without them,
mhm.
right? And this is the anthocyanins that you can find in berries and the glucosinolates and sulforaphane you can find in cruciferous vegetables, right? The data is showing that there's so many different types of anti-cancer properties that are found within these different foods that are only found in plants, right? So we can only get those nutrients when we're consuming plants. If we're consuming animal products, we might get small amounts of phytonutrients in that only because the animals would consume the plants that would contain phytonutrients. So very, very little in the grand picture of things. So we see the biggest impact when it comes to fiber as it relates to the plant-based diet. Also, anti-inflammatory properties, right?
Mhm.
The anti-inflammatory properties of a plant-based diet are incredibly huge, and so we see that from that component with the plant-based diet reducing cancer risk, but also especially in hormonally related cancers like breast cancer, prostate cancer, and some of the other gynecological cancers where hormones are a big deal. We see that plant based diets can more naturally regulate the hormones. And I always tell people, like, we want just the right amount of hormone. We don't want too much and we don't want too little. And
Goldilocks.
plants and fiber and all the things and how they synergistically work together is really where we see the biggest benefit. And you're right, is that I work with patients that don't necessarily want to be completely vegan, but they do come to me knowing that they're going to at least be plant predominant. But I love how
Mhm.
you say plant positive. I think that's perfect. And I will say though, so at the beginning of working with a new patient, or even like on our discovery call, I'll say, what is your goal? Do you want to be 100% plant based? Are
Mhm.
you interested in just plant predominance and want to still incorporate a small amount of animal products? I serve both, right? I serve those that want to be completely plant based vegan and those that are plant predominant. And most of the patients, I will say, that come to me and say, I don't think I could ever be completely plant based. I just want to be plant predominant. I should get some actual data on this in my practice and start tracking it because a large percentage of those people actually become completely plant based in the end. And most of it is from saying that they feel so much better, they notice a big difference, or they want to try it over time and they just never go back, kind of like I did.
And even listening to you talk about the symptom management, during treatment, it just made me wonder, again, I don't know of any studies, but looking at microbiome changes, as you're going through therapy, and it may be that though, those extra microbes in your microbiome are somehow facilitating a lesser response in terms of side effects. I'm not aware of any data to demonstrate that, so just
Yeah.
speculating, but it is a fascinating conversation.
There is some studies that show that certain types of treatments actually require that the microbiome has certain bacteria to actually improve
Mm.
how well the treatment works in someone. And that's where they see that maybe that's why we see some of the differences in certain types of outcomes in certain people based on their microbiome and the diversity in their microbiome if they're able to have the improved efficacy of that treatment and so forth. It's really fascinating. So there's a couple treatments out there that you can look up microbiome impact and so forth. That's definitely out there.
Interesting. Uh, and it's even more interesting because when I was training, I didn't know about the microbiome. So all of this is fascinating.
Yeah, absolutely.
You mentioned that your cancer was triple positive. And so I don't want to make an assumption, but when you had your hysterectomy, you had your ovaries removed too?
I did not. I
Oh,
actually decided to keep my ovaries, and that
okay.
was a very personal decision
Mhm.
to I am 37, and when I was diagnosed at 33, and Um, yeah, I struggled with that a lot because I didn't wanna be in menopause right now.
Yes, that's where I was
And
gonna go. Yeah.
yep, which you can end exactly for the reasons that you are probably thinking in terms of my muscle mass, in terms of my bone health, in terms of my heart health. Those were all things that I was concerned about going into menopause too early. However, there are a lot of women that are either that have to go into menopause like by chemical
Mhm.
induction, whether it be through medications or surgically. And my oncologist wants me to consider it at 40. I'm not even sure that I will do it at that point. But that was a topic. And so, really, what I chose to do so I had my uterus was removed, and so was my fallopian tubes. And really, the
Okay.
fallopian tubes was the purpose of we believe that ovarian cancers often start in the fallopian tubes.
Mhm.
And so if I can remove my fallopian tubes because I'm not using them anymore, then it may reduce my risk of ovarian cancer in the future. But there's with my PCOS, there's so many other like nuances to that, right? Which impact my ovaries are producing more testosterone than they should and all the things, right? So yeah, there's a lot of complicated things about that. But I'm happy to answer any questions or like talk about that as well when it comes to menopause and breast cancer, if that's something that you want to dive into.
I think it's a well, I'm glad well, I won't say I'm glad. I think it's an important question for many women because especially now that the menopause conversation has taken such predominance, if you're if you're put in a position where you have to make this decision, it can be a hard decision because you know the long-term benefits of keeping the estrogen for as long as you can.
Mhm.
And yet there's this balance between am I potentially fueling any cancer cells that may be lurking out somewhere? So, again, another three-part question. Um, for women who do go through either surgical menopause or chemical menopause as part of their cancer journey, do you have any specific advice or recommendations for them regarding nutrition? And second part to that question is, do I have to not eat soy anymore because
Yeah.
soy is not good if I'm a cancer patient?
Well, that's a great question because my one of my top recommendations for a woman going through early menopause as part of their cancer journey is to actually eat soy. And this is, as you know, a huge topic when it comes to the cancer space, but also in menopause too, in that there is this idea that consuming soy increases estrogen, which therefore increases the risk of breast cancer or other hormonally positive cancers. And the data does not show that, right? The data out there in hundreds, if not
Inflammation.
thousands of yeah, exactly, like, oh, like, of human studies, they either show neutrality and that it doesn't increase or decrease risk, or that it does actually decrease risk of breast cancer, prostate cancer, and other hormonally based cancers, and how beneficial it is for heart health, bone health. I mean, the list goes on and on. And so this is a topic that I am constantly trying to dispel among the cancer community or just women in general. That a lot of people avoiding soy as a scare of increased risk of cancer. And I'm a triple positive breast cancer survivor. I'm eating soy probably every day, if not multiple times a day. And my kids are too, right? We actually do show that 2 to 3 servings of soy foods per day is actually safe and actually potentially beneficial. And the earlier you start in terms of childhood and adolescence, the greater benefit we actually might see. So I actually didn't start eating soy really honestly until my late 20s,
Mhm.
probably. I joke with a lot of my clients too, because like I said, I didn't grow up plant based. And the first time I ever bought tofu, it sat in my fridge until it expired. And I said, okay, it expired. I can throw it away now. Right? Like I tried. Like I consider that like the contemplative stage, right? Like I thought about it, I bought it, but I didn't quite get all the way there. And now, gosh, I was at Aldi the other day and I was just going like this, like grabbing it off the shelf with the tofu. And my kid, it's my oldest daughter's favorite food, right?
Uh-huh.
So yes, I very much believe about soy and for women in menopause as well. And the menopause truly to help with hot flashes that I experienced hot flashes very intense when I was through, fertility treatment and, I had mentioned with the PCOS, I did have
Mhm.
some fertility treatment, and I had such intense hot flashes that and I was, gosh, I was 28 or 30, and when the whole topic of menopause came up too, I was like, "Oh my gosh, I don't know if I could live with that." Like, 'cause I remember, like, looking at my husband, I was like, "I love you, but do not touch me," like, 'cause, so I've experienced it, and
Yeah.
that there was so one part of my journey is recommended to be on tamoxifen for 10 years. Um,
Okay.
Long story short, I have decided personally, I have stopped taking tamoxifen. I did have some hot flashes with it, but not intense, and I will absolutely say for the time that I was on tamoxifen, I can tell you that if I wasn't eating soy regularly, my hot flashes were more frequent and more intense. So
Interesting.
I did notice a difference, and I believe it's the WAVE study, right? Women, you'll be. I don't know if you can tell me the acronym, but the WAVE study of menopausal women and the incorporation of soy into the diet and how there was drastically reduced symptoms of the hot flashes and vasomotor symptoms when there was soy included in the diet. So that is one of my top recommendations for women that are experiencing that early menopause or menopause itself to help reduce the side effects of hot flashes, but also physical activity. I mean, exercise can play a huge role in providing some benefit when it comes to side effects from menopause as well.
And well, that and so many other things that
Mhm.
it's helpful for. Yes, the and we can put a link to the WAVE study with the show
Yeah.
notes. It's
Yeah.
the Women's Study for the Alleviation of Vasomotor Symptoms
There you
from
go.
Dr. Chadad.
I knew you would
Mhm.
remember the name of it.
Well, only because I teach a menopause class, so we also talk a lot about the benefits of soy.
Yeah, absolutely. There's just so many good things and, like, there's so many different ways to use it too in terms of tofu, and my kids just like it rather plain, and then but there's so many different sauces and ways you can use it and crumble it and bake it, and there's gosh, it's such a great source of protein and calcium if it's calcium set like, there's just so many great benefits of it, and at least where I live, it's $1.55 per, like,
Ye
14 ounces, like, it's incredibly inexpensive compared to, like, a pound of meat, for example.
And you can make it taste however you want.
Mhm, absolutely.
Allison, is there I wanna be respectful of your time. I don't know when the girls are gonna come off their study break.
Oh,
Are
dad
they
yeah,
done for
so
the
I'm
day?
not worried. Dad's home, so I'm not worried about it.
Okay, okay. Um, I always like to talk about mindset because I think it's the foundation for anything we're talking about with health, whether it's prevention, disease management, um, and mindset. I know that's a nebulous thought, but how do you or how have you shifted your focus from not feeling like you're managing disease to focusing on being the healthiest version of you?
Hmm, that's a really good question and a really tough one that constantly changes. Um, I will say that when it comes to my cancer diagnosis, a lot of people ask me, "Have you changed your diet since you
Mhm,
had cancer?" Honestly, not that much. I've emphasized things a little bit more, like the cruciferous vegetables or, working a little bit more on focusing on my metabolic health, etc. But the biggest change that I have made in my life since my cancer diagnosis is my mental health.
mhm,
And there's so many different pieces and avenues of that I would say that's my biggest challenge, but also my greatest space where I've made improvements in my life over the last few years. And I would say for me, maybe people could already tell from my conversation, I'm very type A. I'm very perfectionist type approach, right? And I have had to challenge myself a lot in that area.
yeah.
And with that personality, like maybe a lot of listeners, I would assume I'm a go, go, go rest. Like, what? Rest? I always have to be doing something, right? I have to be productive. I have to cross off this list, all the things. I have had to challenge myself in rest a lot. And so when it comes to mindset and mental health and this whole like grouping together,
Mhm,
one of the biggest things that I will say is that was transformative for me was working with a counselor therapist through my cancer journey. And we worked together for, gosh, nearly 3 years throughout treatment, surgery, survivorship, all the things. And how much that I've grown from that is really positive. But one of the things
mhm.
that came out of that is I went to my counselor one day and I was like, I have a new mantra. And she was like, oh, let's hear it. And I said, I don't do overwhelm, right? And I just repeat to
Oh,
myself, I don't
interesting.
do over and I had a little notebook, like a note card on my desk that said, I don't do overwhelm. I don't do overwhelm. Because I would always, and sometimes it still happens where I'm like, sure. Yes, I'll do that. Okay. Yes, I'll
Yep,
do it. Right.
yep.
I know so many women, people in general, but especially women have that tendency. Right. And she goes, Allison, I love it for you, but you're going to have to add something else to that. And I was like, okay. She goes, I don't do overwhelm. And sometimes that will feel uncomfortable,
Oh, yes.
right? How uncomfortable it is to say no,
No.
how uncomfortable it is to
Mhm,
say, I'm just going to rest and be and not be quote
mhm,
unquote productive. Right. And I think that is probably where my biggest mindset shift has come is I have found that there are days where I'm working and I'm like just maybe staring at the screen, being like, what is happening? I'm like, I need to take a break. And I don't thankfully have to do this as much anymore. But when I was going through treatment and recovery, I had to take naps a lot during the day. So I'd take a break from work and I'd lay on the bed and I'd set a timer for 30 minutes and I would just rest.
Mhm.
Because the previous me would be like, no, I have 30 minutes. I need to get it done. Right? And then I come back and I find that actually I'm way more productive if I take that 30-minute rest, right? I used to work all the time after my kids went to bed. I'm exhausted at that time of day. I'm not getting good work done, right? And so I've really had to focus on my mindset in terms of allowing myself the space to rest because I actually am more productive if I do that. And then also, I have worked really hard on creating boundaries and protecting them. And I'm probably the biggest culprit to my own boundaries.
Mhm.
And so that has been a big shift in terms of that. And what coupled with that again, because I think it's so multifactorial, is really focus on I'm doing what I can to take care of myself and if I'm not, why? Right? Am I taking on too much? I have my own practice. I have 2 kids. I homeschool, right? Like I don't like there's a lot that I right?
A
I
lot
the
of
private
overwhelm. You're making me
right?
feel overwhelmed.
But I do have I will say like there's been a lot of things that I can finally say like no, I just can't do that.
Yeah.
Right? And where is my energy being directed? Is that where I want my energy being directed? Or do I want to preserve it for something else that would fill me up differently? So that's a loaded question. There's a lot to it, but I do think that that's a continuous work in progress. And I think that it's just like nutrition and lifestyle, it's always going to be a work in progress. And I think what can be discouraging about it is that the journey never ends, right? You're always
Mhm.
working on it. But I think what's encouraging about it is that if you wake up one day, you continue to get to work on it, right? As long as you're here, you're still get the opportunity to work on it. And so I have been able to lower a little bit of my perfectionist type personality and accept that I'm doing my best in different situations. And if I am not able to give what I want into one direction, I take a step back and say, what can I say no to so that I can say yes to the thing that fills me up or fills my family up or whatever that might be?
Thank you for sharing that. And I
Mhm.
only hope that every woman listens to you because it's not just you.
Mhm.
Setting boundaries, knowing that no is a full sentence, um,
Mhm.
being a people pleaser, having that tendency to be, want to be perfect when there
Mhm.
is no such thing as perfection.
Mhm. Nope.
We beat ourselves up. And
100%.
you don't want to wait for those stresses to compound and impact your health if you can even if you work on one of them now.
Yeah.
Um, but I agree with you. It is a lifelong journey.
Yeah. And I mean, unfortunately, cancer forced me to figure it out, right? Like I don't want other people to have something that literally is going to force them to drop everything because they have to deal with something
Yeah.
else, right? Like I was forced into that and I don't want to be forced into it again. Um, Unfortunately, I do think for some of us, it takes a truly life altering um, thing to happen in order for us to make that realization. And I do think that is probably one of the things that cancer has taught me. Like there are certain things that I think I knew I needed to learn, but there there wasn't enough to teach it to me and cancer was what taught it to me, right? Like what's truly important in my life. And that I can say no, and that I also don't have to explain why I say
Mm.
no, right? It's just no. And I do tend to explain, but sometimes I'm getting better at reminding myself I don't need to have an explanation, right? And so yeah, I that is probably one thing that I want everyone to take away, even if it's not the soy or the whole plant-based foods, it's how we manage our stress because I honestly think, yes, our diet in the United States and other countries is very poor and needs lots of work. But I would maybe argue that our stress needs just as much work, if not more.
Our stress and it's all the untangibles in a way.
Mhm,
Our stress, our sleep, our
mhm,
community. I think that I don't wanna underestimate the impact, and I love that you give back. I mean, when you talk to the plant-based prevention of disease community, community is key in sharing what we know with each other, but I'm hopeful that whether it's Peapod or whether it's this podcast, that some of it fills your cup too
Yeah.
by maybe not touching a group that you can touch tangibly, but the fact that you can touch thousands of people just by sharing your story.
Yeah, absolutely. Yeah, and that's my hope by sharing because I did think for a very long time whether number 1, whether I was gonna make my diagnosis public in the space that I was in, um, and also if I was going to stay in the oncology space
Mhm.
after being diagnosed. And I reflected very deeply on that for quite some time, and I felt like, 1, hopefully sharing my story will inspire or encourage others, or even just encourage others to get a suspicious lump checked, right? I say it is guilty until proven innocent, right? Or from the other standpoint of things, is that really truly that maybe my story can help encourage others to make lifestyle changes, to improve their mental health, so many different things. And then I think I have a lot to offer when it comes to going through this very unfortunate diagnosis. I felt like I wanted to give back to this community and the cancer community in that like there are things we can do to help ourselves. And although I'm not saying that it makes cancer and its journey easy by any means, I had my hard days. I still have my hard days, whether it be physical or mental or emotional. Uh, but we can do something about it. And how do we do that? And helping other people find their ability to do that.
And as we wrap up with I mean, that was a great lead into a question if you can't answer it, that's okay. But for anyone who's an oncology resident, an oncologist, an oncology nurse, what from your journey would you like to share with them? And it doesn't have to be nutrition related, but I do think that there's an opportunity to share some pearls of wisdom that maybe it will resonate with someone and they can take that and pay it forward to one of their patients.
Yeah. It is going to be nutrition related. And that is nutrition matters,
Yes.
right? All too much, I hear people say, nutrition doesn't matter, like, it's not gonna help you or hurt you or anything in like, it has the power to really help us, right? And, it helps us reduce our side effects, improve our quality of life, and all the things. I actually had to I had a conversation with another dietitian with a patient, and we kinda disagreed a little bit on what the approach was, and I had to remind her this particular patient is a 40-year-old male with stage 4 pancreatic cancer.
Oh. Mm.
He has a 5-year-old son. I said, "This isn't just about the nutrients. This isn't just about the nutrition. This is about this gentleman's quality of life." He has a 5-year-old son. This is about trying to make sure we're optimizing his quality of life as best as humanly possible, right? And that's what it was for me during my course of treatment was I protected my energy as much as I could so that I could walk my kids to school every day, right? That I was able to do bedtime with them at night because those were the things that were incredibly important, right? I'm a food nerd. I could barrel it down to all the phytochemicals and the fiber and all these things, but in the end, at the end of the day, it's about quality of life and being able to live and be present for life's most meaningful moments. And those most meaningful moments don't have to be these big, huge, grand gestures. It could be walking your kids to school,
Mhm.
bedtime, seeing their play, seeing their right. Like, so I want to circle back to nutrition matters and the data shows us it matters, right? Now, nutrition research is never going to be perfect. I think people are waiting for that perfect study all the time for a double blind randomized control trial about nutrition. And it's not going to happen. So we have to work off of the best available evidence that we have. And that is nutrition matters. And unfortunately, if your oncologist or your oncology dietitian or anyone else says that it doesn't matter, I think you maybe should seek a second opinion.
Agreed. And I'm gonna elevate that one level higher. What would you say to whether it's HHS or FDA, in terms of
Mm.
the importance of understanding that food matters from a population perspective, because I don't know the role of how we fuel our body in terms of prevention per se. I think we all have ideas, but if you were queen for a day and you were in front of Congress and you could say, "Hey, you need to think about this." And I didn't prepare you for that one, so
You
sorry.
did not prepare me for that one. Gosh. Oh, I guess if I were standing in front of and because I always say that I do not have the answers in terms of figuring out how we make their government and society and all that have, like, healthy nutrition, right? But I do think it stems from having an open ear and an open mindset about hearing about how nutrition makes a difference,
Yeah.
right? Because I think especially when it comes to many different physicians or healthcare professionals, because they didn't learn it in school, they think it doesn't matter, right?
Mhm.
And so would often say some of the teams that I worked with in college, I would present to them over and over and over again and give them the data and all that kind of stuff. And it felt like they had blinders on. Right. And because they didn't learn it in medical school, then it doesn't matter. And it's like, number one, time changes, research
Mhm.
changes, right? Like there's all these things. So being open to hearing about it rather than just having one stance on it that is never changing. And I always say, I used to think I am completely honest, I used to think the vegan diet was insane. I like I remember having, like, a family friend that was vegan, and I'd be like, "She's crazy. Like, there's no way that that is healthier for you," right? And but I saw the data. I had
Yeah.
open ears, and you know what? I am always open to being challenged and being like, maybe this isn't the best for us anymore. Maybe this option really is truly like we have to have that ability to listen and hear, and also know that what we're currently doing isn't working. So, what can we do different? I feel like that's a very loaded question. I could go on and on, but I'm going to leave it at that.
No. I mean, I hope every one of us is a lifelong learner and that we challenge our own biases, and knowledge on a consistent basis, because that's how each one of us got to where we are today.
Yeah.
Most of the people, I mean, I didn't start life as a vegan, and only because I saw the data that did I change. So
Yeah.
I do hope everyone hears that, and I hope that those who have an opportunity to make decisions that impact our population in general are also more receptive to that message.
100%. Yeah.
Miss Allison, I could talk to you forever. Um,
Likewise.
but where if anyone's listening who would like to get in touch with an oncology dietitian, there's maybe some people who've never heard of oncology dietitian. Is there a resource or a place where you would direct them to so they
Yeah.
can have that member on their healthcare team?
Yeah. So, number one, if someone is diagnosed with cancer and going through it, the first place to look would be to ask your oncology, your cancer center for a referral to the oncology dietitian. There are different guidelines for different hospital systems and just like the overarching bodies that regulate that they have to have access to a dietitian. There might not be a full time oncology dietitian dedicated to that cancer center, but they should have access to one. So, asking for a referral. And then there also is an oncology nutrition website run by the Academy of Nutrition and Dietetics where you can search for what's called a CSO or a certified specialist in oncology. It does give you a list of names by state of who is a certified specialist in
Mhm.
oncology. It doesn't tell you like if they're private practice or what cancer center they're at, but that can help. And then otherwise, asking, unfortunately, like, because we've have so many people have been burdened by cancer, like, if you know somebody else, maybe see what their experience is. I get a lot of people coming to me just truly by word of mouth, and they benefit, like, "Oh, I heard you help so and so so much, and I would like some help during treatment." So word of mouth can be really powerful too. And yeah, I would say that's probably the best way to find one and ask, are they Are they a CSO? Are they a certified specialist in oncology? And it doesn't necessarily mean that someone that doesn't have that certification isn't good at it. They just haven't taken the exam. But we do have to have the hours of practice before we can sit for the boards exam, and we have to repeat the boards exam every 5 years. So
Oh, wonderful.
we have to stay on top of the research and the changes in oncology, as you know, is rapidly changing. So somebody that is actively certified is having to regularly update their learning on oncology nutrition.
Awesome. Thank you. Those are, and I'll make sure to put those in our show notes too.
Yeah.
Allison, there were so many things that I tried to touch on a lot of the topics that we talked about before we got on air, but is there anything we didn't talk about today or any messages that you would love to leave our listeners or viewers with as we wrap up our conversation today?
We may not be in complete control of all aspects of our health and our situation and our circumstances, but there are many that we do have control of, and focusing on those can really transform your mindset and physical health as it relates to cancer and your journey with cancer.
Awesome. Allison, thank you. It is such a blessing being part of your world. You're a light in this field, and I know that you'll continue to shine for many years to come. Where can people get in contact with you if they wanted to learn more about you, or even I don't know if you're still accepting patients right now or if your roster's full?
Absolutely. The best place to find me is at my website, which is wholesomellc.com. I do have a presence on Instagram, but I'm not active on it. So people can always look there and find it, but it'll just direct you back to my website. Again, it's wholesomellc.com. I do have one on one clients that I take on. I often run a group coaching program, and I'm continuously going to be building out my essentially suite of different products and e-products to be able to help people, whether it be through treatment with side effect management or survivorship and approaching a plant-based diet and how it can help us live our best, healthiest life. So website's always the best, and getting on my email list. I feel very blessed that I get a lot of really good feedback from my emails and my emails that I send out, I aim to send them out weekly, is they're a whole mix of like education, mindset, like me being completely transparent about my own journey and struggles. And it's just a place where I feel like I can sit down, even though I can't talk to each person one on one. Um, I want you to know that I see you and I feel you, and I'm going through it with you too.
That's beautiful. Allison, thank you. And I appreciate you. Hopefully, we'll be able to continue this conversation another time on another topic that we didn't get to touch. But in the meantime, continue to thrive on plants and live with purpose.
Thank you so much for having me.
I really hope you enjoyed this episode. Allison's journey reminds us that while we can't always control what happens to us, we have more power than we think over how we respond. Through the foods we choose, the boundaries we set, and the rest we allow ourselves, and the community we build. Allison's message is clear. Nutrition matters, not just for prevention, but through every stage of treatment and into survivorship. And it's not about perfection. It's about progress, compassion, and controlling the controllables. If you or someone you love is navigating a cancer journey, I encourage you to seek out an oncology dietitian. Visit Allison's website at wholesomellc.com to learn more about her work, access her free resources, and join her community of cancer thrivers. Most importantly, remember, you don't have to wait for a life altering diagnosis to start prioritizing your well being. Start today with one small change, one boundary set, one moment of rest. Thank you so much for joining us on Thrive on Plants. And remember, keep thriving on plants. And as always, keep living with purpose. Take care. The information shared on the Thrive on Plants podcast is intended solely for educational and informational purposes. It is not medical advice, and it should never be used as a substitute for personalized guidance from a qualified healthcare professional. Always consult with your physician or healthcare provider before making any changes to your nutrition, exercise routine, supplement use, or your overall wellness plan. The opinions and advice shared by our guest are their own and do not necessarily reflect the views of the Vegan Gym or its team. While we aim to bring you high-quality, thoughtful conversations, these perspectives are not intended to replace professional medical care. Thanks for tuning in, and remember, you have the power to thrive on plants and live with purpose.